Hi, this is Dr. Bharadwaz. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on what are the causes and risk factor for Duchenne muscular dystrophy. It is known as X-linked inheritance. X-linked inheritance means this disease occurs only in males, not in females. It occurs in boys, not in girls. So we will check deeply why this happens with the help of a diagram. Try to understand this. This is male and this is female. You can see that male has one X chromosome and one Y chromosome. In the same way, female has one X chromosome and the next chromosome is also X chromosome. Females have two X chromosomes, whereas males have one X chromosome and one Y chromosome. For example, if there is a gene that is located on X chromosome here, when the gene is defective, I'm marking the gene in red. You can see that there is no complementary chromosome for it or complementary structure for it. We call this allelic pair. Every genes in the human body occurs in a pair. It will have two copies, one copy from the mother and one copy from the father. So as there is no X chromosome from father, so there is only one X chromosome that is coming from the mother, and this gene is defective and it produces defective dystrophin protein. There is no alternative copy or there is no backup from the father. But in the case of females, what happens? So if there is one defective gene, this is a defective gene from the mother which is on X chromosome, and this is not able to produce proper dystrophin protein, but there is backup. This is from father. Father will give one normal gene. Because of this normal gene, the female baby can synthesis defectless dystrophin protein. That's the reason females act as a carrier. They will not have defect because they will have a backup chromosome or the backup gene in the chromosome. In the same way, the boys will not have it. That's the reason. If the gene is defective, even though it is recessive, they will express it in the form of symptom. This is known as X-linked inheritance. This inheritance is coming from X chromosome. That's the reason this is known as X-linked inheritance. This is the reason for Duchenne muscular dystrophy. And it is two-thirds genetic. What I mean by this is, if mother is a carrier of the disease, two-thirds of the patients are genetic background. What I mean by this is, out of every 3 patients who is suffering from Duchenne muscular dystrophy, 2 got the disease from the mother. Okay, it is inherited from the mother. But 1 out of 3 is a new mutation. Mother doesn't have any problem. Mother is not a carrier, but still the male baby can have it because it is a new mutation. The gene got mutated and it is producing the defective dystrophin protein. So it is out of 3 patients, 2 patients will have genetic background and 1 patient will have new mutation. So females are the carriers, so they will not have any defect or they will not have any defect in the body. They are carriers. Because of this carrier nature, what happens is, the boys born to this mother, 50% of the boys will have this Duchenne muscular dystrophy. Boys will not be acting as the carriers because of the defect. They are not able to reproduce, and boys will not send this chromosome to the next generation.
Fidicus Homeopathy